My name is Branson Eves, nursing 1119. I'm going to be performing an NG tube insertion. We'll go ahead and start with the wound scan.
And normally that's kind of like the patients, they store it, they clean it and store it dry and store it away, so it's just you gotta
Alright, at
have
this point, I've already checked my client's chart, I've checked their allergies, everything's good there, I've checked their orders. We've got a baseline set of vitals, I've provided privacy, I've performed hand hygiene. I'm going to introduce myself to my patient. My name is Branson. I'll be your nurse today. I'm going to explain the procedure. What I'm going to do is I'm just going to place a tube in your nose down to your stomach. A couple of times in this, I'm going to get you some water so you can take a sip and swallow, and we'll advance. If you come into any kind of trouble, any kind of problems, I'm going to get you to just raise your finger if you can do that now, just to demonstrate what you do. Perfect. All right. First things first, we're going to go ahead and make sure that we have our suction ready. Everything's good there. We have our equipment laid out. Everything's good there. We're going to check the nasal passage here. Checking for any kind of deviation, obstruction, nothing like that. I'm going to get the patient to close one nostril, sniff, the other nostril still. I'm going to go ahead and use this right one closest to me. At this point, I'm going to go ahead take my tube in here and measure. We're going to want to go from the nose to the earlobe. Looks to be about 12, and then from the earlobe down to the xiphoid process here. Seems to be around 50. I'll remember those numbers for later. All right. We'll go ahead and attach our syringe here for later. Try to keep everything as close to me as possible. All right, at this point, we're going to go ahead and lay the towel over my patient, and I have them up in the semi-Fowler's position. Raise the bed at a good height. We're going to go ahead and lay out their pan and a drinking cup. Place that there for the patient when they need to swallow. All right. Next thing we're going to do is we're going to go ahead and put on our gloves. Now that my gloves are on, we're going to go ahead and lube up the tube here. Lube is in place. If that comes off, that's no worries. We'll put it on there again later. Go ahead and lube up the first couple of inches of my tube. What I'm going to do is I'm just going to place it in to that first number that I said earlier, which was 12. It will go in. Right, now that I'm at that number, I'm going to get my patient to lean their head forward and take a sip of the water. Every time they swallow, I'm going to push it in deeper. Swallow, 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 swallow. Swallow, 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 swallow.
You see what
And
I'm
the last
doing?
one, swallow. All right. Now that it's in, I'm gonna go ahead and check everything. Okay. We're just gonna pull out a little bit of that. All right. Keeping this crimp, we're gonna put it in there to check the pH. Good. All right, at this point, I'm going to use my pen light. Try to get it up. Checking the mouth, and there's no kinking in the tube. And it's secured around the nose. shirt. And at this point, I'll go ahead and tell them whether it's a feeding tube for medication. I'm going to check the placement with an x-ray, perform oral hygiene on my patient. We're going to go ahead and hook them up to suction. Using some nozzle. Good there. Alright, at this point, if I hear any kind of gagging, coughing, see any kind of signs of cyanosis, we will stop the procedure. I'll go ahead and remove the pan, the cup, the towel for the patient. I'll leave them at a comfortable position. Take off my gloves. The gloves are off. Everything's good with that. Go ahead and document my findings. Perform oral hygiene once again. Now we're going to go ahead and move into be taken out of the tube. I'll have my patient up. I'll go ahead and perform my universal beginnings again. Perform hand hygiene, provide privacy, do all the records, allergies, everything like that. We'll go ahead and have our patient up. Turn off the suction device if needed. Go ahead and crack my hose. Before I crack my hose, I'm just gonna go ahead and have this towel here. Backtracked a little bit, but that's all right. I'll have the tissue ready for my patient. Now I'll crack my hose, unplug that, using this. We're going to put no more than 50 milliliters of air in the tube. Unplug that. I'm going to go ahead and push in that 40 milliliters of air. Now that that's done, I'm going to instruct my patient to hold their breath. And we'll slowly begin pulling out. As I'm pulling out, I'm just going to check for any kind of blood, any kind of mucus residue, anything like that. Seeing none, I'm going to go ahead and fold that up in the towel. Place that to the side. Perform any kind of care to the mucosa, any kind of oral hygiene, nasal hygiene, anything like that. Making sure my patient is comfortable. Go ahead and lower the bed back down no more than 30 degrees. Put the appropriate bed rails up. Take off my dirty gloves and document once again. Brain scan.